are best buddies anyway. So. All right, you guys, this is my favorite lecture. So you are in for a real treat. Little housekeeping first. Welcome, reminding you again to please do not ask questions during the presentation. Jot all your questions down and come back at 5 o'clock for the speakers forum, which will be upstairs, and you will earn 1 CE credit for the speakers forum. Filming of our presentations are not allowed. We'll mail you the edited presentation links within the next few weeks. And reminder to play the game, it's in the cards, so ask the vendors. Potential to win a free conference. Also, if you have no plans for dinner tonight, we have a few spots open on our reservation lists. Sign up during the next break at the reservation desk. So I want to introduce to you my dental bestie, and Catherine too. So the Three Musketeers, yes. Fran Horning is a certified and accredited biological dental hygienist and associate director of the International Academy of Biological Dentistry and Medicine. She serves on their board and is the Hygiene Committee chair. She's also a Hygiene Committee member, mentor, and lecturer for the International Academy of Oral Medicine and Toxicology. So she goes both groups. We are sister organizations. She lectures at and for several biological and traditional organizations across the country, is an international public speaker, and performs individualized on-site office training, hint, hint. She's a qualitative director in charge of training biological protocols in the most prominent biological practice in her state. Initially, she is a coach and trainer for biological dentistry and biological dental hygiene, and is the owner of Integrative Perio Solutions and Hygiene Naturally. Fran is an active member of the IABDM, IAOMT, ADHA, and AAOSH. You are. Her presentation and training receives rare reviews. So, rave, sorry. She's doing so good.
She barely gets a review. I'm out of here.
So you will enjoy and learn so much about ozone from my friend Fran Horning. And then I will give you the code at the end. So enjoy. Thank you.
Thank you.
Okay.
Mutual love affair we have with each other. It's hard to find a sisterhood. And then, of course, guys are coming into the field, so we're going to have to change that. Sisterhood of biological dental hygiene. We're really trying to advance the practice. I started doing that back in 1984. Yes, I'm an old broad. I've been doing it for over 40 years. I enjoy what I do. One thing, like I mentioned yesterday, I take what I do very, very seriously, but I do not take myself seriously, so I might interject a little silliness. Please don't take that as something I think that what I talk about is flippant. It's just, sometimes it can get a little dry. So, that being said, we're going to talk about ozone applications in dental hygiene. You probably are already using ozone, but are you using it to your full extent? When I first started practicing in '84, there was no such thing. It really wasn't very prominent. We were using a lot of the pharmaceuticals, chemotherapeutics. Those who have been around a long time like me, we were using tetracycline for perio, and we found that that was not cool. So the fact that we have this amazing tool, and it's oxygen. It's oxygen. And be able to have a supercharged oxygen that can modulate the immune system and at the very same time reduce the pathogenic load and infiltrate into biofilm is just an amazing, amazing tool. So what I want to talk to you about also is the difference between ozone, the ozone generators, and medical grade ozone, because whether you're a practitioner or been in the field for many years, you may know the difference, but some who are just entering the field, and patients ask questions, or you say, oh, I'm going to use ozone. They're like, ozone, that's bad, that's a pollution. Or you can't breathe ozone, that's bad. But you have the difference between naturally occurring ozone, regular ozone, and medical grade ozone. So I want to talk to you about what's the difference, how to explain it to your patient for those who don't know, and those who do know, you know, and this might hopefully will just enhance your knowledge. Ozone will come in 3 forms. Of course, it's naturally occurring. How that occurs is, of course, the ultraviolet light hits the oxygen molecules in the stratosphere and creates ozone. Also, we can take ozone gas created by a generalized generator, which takes oxygen from the air, and that you can make ozone water with that. Or you can use medical grade, which is you're taking pure oxygen from an oxygen tank. So there's different ways that we can use ozonated water, and then ozonated oil. Several different ways you can use ozonated oil, say in the periodontal pocket, or you can use it as a topical for an irritation, intraoral irritation. I like to keep those little things in my refrigerator at home, any abrasions or whatever, or I put it on my skin. It's great. So let's talk about what most patients, and a lot of our patients come into the office, they already are very learned on the difference of ozone, but then some people are just starting their journey in the biological world, and they really don't know the difference. So I want to talk to you about what is the ozone layer and why it is totally different than what we use in our operatories. So as I mentioned, the UV light hits the oxygen molecules and creates ozone. And we need the protection of the ozone layer because otherwise we can potentially be fried alive. We get, skin cancers, the UVB and UVA radiation can cause multiple types of damage. So ozone in the stratosphere is a good thing. You want that. And unfortunately, it's being damaged because of a lot of other things we're going to talk about in a moment. And then the troposphere, which is much closer to ground level, that actually can have a lot of damage to it, and it's a lot of pollution due to chlorofluorocarbons and pollution from cars, et cetera. That's the pollution or ozone that people say is bad. So that we don't want, because this is a picture of, say, like of LA. They say it's a bad ozone day, because there's a lot of the pollution that is in that tropospheric area. But we do need the ozone in the stratospheric layer. Back in the 80s, when I was my heyday clubbing days, we destroyed the ozone layer with all this spray, the high hair, okay? Destroyed it. So, yeah, I have much less hair now, but yeah, I was there. So what was happening with all these chlorofluorocarbons, we were destroying the ozone layer. And this is actually from NASA. This is as of last year, excuse me, I'm trying to get this to play. This will show you, there we go. It's going to show you the areas of blue and purple is where the ozone layer is very, very depleted. The red and yellow is where there's more ozone. This is the Antarctic. So what's happening is there's bigger holes. We're losing that protection. So as that ozone layer gets bigger, it's going to go around the world. We're going to get less and less protection. That's why we want to make sure we reduce any of the pollution that can actually create that to get much worse. For those who know, but I'm going to give you a quick little science tip of how ozone is created. You have your oxygen molecule, which is 2 atoms of oxygen, O2, correct? And what happens is you need electric current, whether it be through waterfalls, electricity, or lightning storms, that's going to break that bond. So now your atoms are floating around. They're free floating, and they need to actually get balanced. Okay, they're negatively charged, so they have to attach themselves to something that is positively charged. That is your O2, so that becomes O3. Your O3 is now becomes unstable, and it needs to find another positively charged bacteria, virus, parasite to be able to attach to. How is it created? There's different ways that ozone is created. Our own bodies create ozone in our cells. Corona discharge, cold plasma, all right, lightning storms, naturally in the atmosphere like we just talked about. Also, anybody ever go outside after a lightning storm and that smell smells so clean? That's ozone, because the electricity of the lightning has now broken the the oxygen molecule and created ozone. Also, during waterfalls, that disruption of the oxygen molecule through the water flowing creates the electron to separate, and then you'll get your ozone. What a lot of people are talking about how ozone is bad, they're using generators like this. This is the generator that you put in your basement when your basement smells moldy and musty. This you cannot go in the same room. During that cuckoo shutdown, a couple of years, When we were starting to practice again, unfortunately, there was a shortage of N95s. So what we were doing is we would have to, unfortunately, reuse them. We would put them in containers with holes and put them in a closet, turn this on, and put it in the closet, close the door, and we had to walk away. That was up on our second floor, and you couldn't even be anywhere near it because that strong smell. But there are multiple studies showing that it is very effective in disinfection of the mask, so we unfortunately did that. So I've actually walked into that room, and I could tell you, you do not want to walk into that room. The choking and the coughing and the excessive lung irritation is just outrageous. So when you're telling your patient, we're going to use ozone, they may automatically think this. That's not what we're using. But it's a good thing in hospitals. They can use it for sterilization. They also use that type of ozone when they're sterilizing, or excuse me, not sterilizing, disinfecting water for like pools. And actually the water that you drink, does any of you have like a bottled water with you? Like a bottle of water like this? I can guarantee you this has been cleaned with ozone. Most of the water that you find in bottles is cleaned by ozone and not chlorine. Because chlorine will give you flavor, and it's also a carcinogenic. Because as it starts to break down in the bottle, it's a carcinogenic. So you don't want that. The ozone in your bottled water is going to remove any odor, taste, color. And so that's why when you're drinking that fresh, clean tasting water out of the bottle, it's probably because it's been ozonated. Okay, so it's really cleaning that water. And then, oops, see, we didn't want to do that. We want to do this. So you can get a water filtration system with ozone on it at home. You can also actually clean your fruits and vegetables. You can get these ozone units that take the oxygen out of the air that we breathe, which is ambient. It is not the best because there's other gases in the air, nitrogen, hydrogen, et cetera. So you're not going to get as potent of an ozone, and plus there's the potential of concentrating some of these other gases. But it's good to clean our fruits and vegetables. All right. I like that only because, as a hygienist, a lot of my patients would like to make their own green smoothies. They're using the kale and such. And for those who use a phase contrast microscopy, if you know, you can find these critters. You can find amoeba, et cetera. And a lot of times the patients are using the fruits and vegetables, but they have not thoroughly washed them. But if they're using the ozone cleaner, they're going to be able to clean their vegetables much better before they make their smoothies, which is going to prevent them from having any pathogens potentially orally. And of course, you have your ozone oil. You can make your own ozone oil. God bless you. It's a pain. But if you're so inclined, go right ahead. Otherwise, you can get these ozone oils from other companies, and it's great to have in the office for local irritations, abscesses, stuff. And like I mentioned, you can also use the ozone oil subgingivally, use an irrigant, and you just place that in the pocket post-surgery, post-scaling and root planing, and the ozone will last for quite some time afterwards. And that's why I love ozone, because it's not a one and done. The benefits will last for weeks. Our bodies produce it in our cells. It is actually produced in antibodies during bacteria killing and inflammation, and our white blood cells utilize ozone inside the cell to kill any invaders. And as I mentioned, it's currently used in bottled water, and it's also approved to be used for organic foods, and it's widely used in hot tubs and swimming pools, which is good to know because, again, the chlorine, we ever go swimming in a chlorinated pool, how you stink when you come out, and it's hard to get rid of that odor. And plus, it's carcinogenic. I certainly don't want to be swimming in it. Also, here they did a study, and how safe it is, because everybody said, well, it's not really safe to use ozone. This study shows that there were only 40 adverse reactions out of 5.5 million treatments, which is 0.0007%. So it's infinitesimal. So my reward is so much greater to even consider any of the risks. And I'm going to talk about some of the contraindications of using ozone on what patients. So I want you to take a screenshot of that when we get to it. So medical grade ozone what and how do we use it, and what is the science behind it. In my search, as of today, there are 76,000 research papers. I only go to Google Scholar. I don't want to just go to Google or PubMed. I go to Google Scholar, which is going to pull out supposedly all the cleanest studies. And in 2023, there was over 3,000 studies alone. So it's constantly being studied more and more. And unfortunately, I'm surprised that we've not had more pushback from, whom, because, let's face it, it's oxygen. Can't make money off of oxygen, can we? So, all right, I'm going to behave. So, oxygen ozone is created from pure oxygen tank. You can get a large tank like this. Most offices will use a smaller tank. You can actually even get a little mini tank. You want to actually attach to your cart if you have it on a cart, or if you have it on a countertop. Like this setup here. This is my old operatory that when I used to do clinical. This was literally right behind me. My patient would be right in front of this unit, and I would be able to make my ozonated water. And you can see here that I have my ozone oil, where I would give ozonide treatments to my patients during my SRP, which we're going to talk about in a minute. How many are giving ozonide treatments to your patients during your SRP? One. When you all leave, you're all going to be doing it on Monday. All right? You're going to start doing ozonide therapy during your treatment starting Monday during your SRPs. But yeah, so you have different types of units. You have your longevity, which of course is another company now because they are now unfortunately not in Canada any longer. And then you have another company that's here, another great unit with Promo Life. They have great little units. And this is how it would work. This is a setup. It's a great thing. If you have one unit for the doctor and the hygienist, you can cart it from room to room. In a perfect world, it'd be great for each to have their own unit, especially if you're going to be using it more in your hygiene room during your SRPs and your other procedures. It's, that's a goal to attempt to get. Again, this is the same picture about how the oxygen molecule will split and create the ozone gas. This one I like is because you can see here that O3, that third atom attaches to the pollutant to oxidize. Now, I want you to remember that word oxidize, because then oxidize means kill, right? So then you have something that anti-oxidize or antioxidants. So that's what you're going to take if you're exposed to ozone, and that's what actually prevents good bacteria and good cells from being killed. There will be clad hole damage, which we're going to talk about in a minute. So, ozone has a negatively charged area, while the biofilm, bacteria and viruses and fungi are all positively charged. That's why it's drawn to it. It will attach itself to it, and it will cause lysis of that bacteria and diseased cells. A lot of people say, well, what about good bacteria? Yes, you can unfortunately get a little bit of collateral damage. Some of the good bacteria will be killed. Not much, but some. But that's okay, it doesn't matter, because they will replicate and proliferate so quickly that it doesn't matter, it's a moot point. So basically, ozone will attach itself to anything that does not have an antioxidant, which is bacteria, viruses, fungi, and parasites. So why do they destroy it? Because they lack the antioxidant enzyme on their cell membrane. And what is an antioxidant? Basically, an antioxidant is something that prevents oxidation. That's why a lot of people take antioxidants to remove free radicals. Oxidants will cause you to age. For us women, we're concerned about our wrinkled skin, we're getting wrinkles around our eyes and the saggy skin. That has a lot to do with a lot of free radicals in the body. So that's why we take antioxidants, all right? Because we want to look young forever. But the healthy cells do have antioxidants on it, and they actually have it on the outside and the inside. So healthy cells, because they have antioxidants, are not going to be affected by the ozone. Now let me just explain in a very simple term, and this is how I train a lot of my offices. I tell them, how do you understand what an antioxidant is? Say there comes a day I ever get grandkids. Hint, Michael. if I ever get grandkids, I'm going to go buy a swing set from Lowe's or Home Depot and put it in the backyard. So I can just buy it and put it in the backyard, and I live in Jersey. You can't tell by the accent. I put it back there with the rain, the snow, the sleet, and everything. It's going to start to get rusty, right? And it's going to start to rust out. But what if when I buy that swing set, I buy a can of Rust-Oleum, and I paint my swing set with Rust-Oleum? It's going to prevent that from rusting, right? So that Rust-Oleum is like an antioxidant. So if some of these cells don't have Rust-Oleum on it, or the antioxidant, that's why they're going to get killed. And that's your bacteria, viruses, fungi, and parasites. We are creating a controlled oxidative stress, meaning we are controlling what we're killing with the oxygen, the supercharged oxygen, okay? We want to induce a multivariate biological response. So, what are the fundamental facts? It's a disinfectant. Does not sterilize. It's a disinfectant. It's a non-toxic wound healing. Doctors, you're probably using it during your surgical procedures. You're using it when you're doing your cavity preps. All right, if you're doing any kind of cavitations or extractions, it's a great wound healer. Perio, doing SRP, patient is very inflamed, you're using the ozone, it's a great wound healer. Improved accelerated wound healing. Why? More oxygen, and plus you're improving the function of the mitochondria, which we're going to talk about in a little bit. Modulation of the immune system. Huge. Has an anti-inflammatory effect, increases circulation of nitric oxide. Nitric oxide is key, especially if your patients have high blood pressure. You want to make sure that they have a good level of nitric oxide. So by using ozone, you're going to actually, like a side perk, you're going to help hopefully their high blood pressure even, because you're increasing their nitric oxide. And that has a high redox potential. You're also going to activate the red blood cell metabolism because you can have more oxygen. Ever used ozone in a surgical site or even a perio and that bright red because of all that oxygen that's in the blood, in the red blood cells? It's beautiful. Yeah, we're a strange bunch, aren't we? Oh, look at that beautiful blood. Yeah. Anyway, activation of the enzymatic antioxidants. Again, we want all those antioxidants. Activation of immune competent cells, because we want the immune system really be triggered, because that's the beauty of it. When I was giving the course with Barbara and Catherine yesterday, I got a little overexcited, and it's like, I've never seen such an amazing tool. It's pure oxygen, not only reduces the bacterial load at the exact same time, boosts the function of the immune system. What in the allopathic world does that? Nothing. Nothing. It only is their fibroblast inhibitors or their pharmaceuticals, chemotherapeutics that cause other side effects. And here we have pure oxygen that can make a huge difference in your procedures. Also, you have your increased oxidant capacity through activation of the cellular antioxidant systems. So what are your immediate reactions when you use ozone? You're going to have your improved oxygen in the red blood cells, you can have the growth factors, and you can have immune activation in the leukocytes, which are white blood cells. Your delayed reaction, you're going to have an increased nitric oxide, upregulation of the oxidative stress proteins, and bone marrow, generation of supergifted erythrocytes, and release of stem cells, which is a beautiful thing. Again, what in the allopathic world is going to do that? Nothing. Pure oxygen. That's all it is. The administration of medical ozone is increasingly recognized in management of plethora of diseases, and one of them being periodontal disease. So Hygienist, there is studies that are proving why you're using ozone and why it is so beneficial for your patients. And of course, you have a whole host of other things here. It's safe, non-toxic, true biologic agent, minimal to no side effects, and economic value, or economic therapy. Many things it can do: boost the immune system, oxygenation, germicide, etc. This is why I love it so much. Again, practicing as long as I have, we didn't have these tools back in the day, And I could never I could never figure out why I could not help my patients. They kept coming back. I thought I did the best SRP possible, but they were still inflamed and bleeding. This is a way that we can definitely help our patients. And just another study just saying that how beneficial it is, and it is minimally invasive and extremely beneficial to your patient. Why you want to really use it? There's a new study that came out back in November, I believe, that there is a new variant of Porphyromonas gingivalis that is antibiotic resistant. With all the antibiotics we're taking, and I am going to say this out loud, I love all the salivary testing companies, but all the salivary testing companies are recommending antibiotic therapy for your patients. Kind of like back in the day, that everybody was getting tetracycline for perio or doxycycline, you know, those small dosages over a period of time. And we're creating these antibiotic-resistant pathogens. With ozone, they're not going to get that. So that's why we really need to find solutions, and ozone is definitely a solution. We've been using it since the 40s or before with little to no side effects. Dental practitioners need to know the proper usage of ozone therapy, and I mentioned it yesterday, proper ozone hygiene, making sure you have your proper dosages. I'm not here to train you on dosages, gammas, anything like that, but I'm going to talk to you about ozone hygiene. Your trainers are outside in the exhibit hall. You know, you can go find them. They can train you specifics on gamma, etc. The reason why it is so critical is because there's 4 pillars of health, and we need to be able to make sure our patients are able to detoxify and eliminate. We want a restoration of the microbiome and nutrition, and also rebalancing of the regulatory systems and cell regeneration and autonomic nervous system. Ozone is one of the tools in our toolbox that we can help this when we are able to boost the immune system and reduce the pathogenic load, help restore the microbiome, etc. So, biological dentistry is rooted in regulative medicine, and we're using a biocompatible material like ozone is extremely beneficial. And then also, we need to look at the terrain of the body. So if I can use something that's going to modulate the immune system and work better and have a great SRP, I'm going to have a better result. So I want you to use ozone as much as possible, not just gas and water. I want you to also use it through the nasal insufflation. I want you to take a picture of this, please. This is your contraindications for use of ozone. Hyperthyroidism, a recent MI, severe anemia, pregnancy. So there are some studies say that it's okay in pregnancy. I'd rather err on the side of caution, and I'm going to go with no, okay? Maybe the ozonated water in and of itself might be okay, but not the gas insufflation or the nasal insufflation. I would not do. Acute alcohol intoxication, that patient's being sent out the office anyway. They're not staying there. So I don't know why they put that there, but, you know. Anyway, so this is important to have, so that way you see a patient with a medical history, there's contraindication that you know not to use it. These are some of the side effects if you are exposed to the ozone gas, and that's why ozone hygiene is really super important when you're using it. Whether you're a hygienist or a doctor, you have to make sure you're properly ventilating the area. What can you do if you are exposed? A lot of offices will keep little packs of that emergency vitamin C, or like the liposomal vitamin C from another company, Live On. Keep that vitamin C, or the N-acetylcysteine, which is another antioxidant. You can buy those as tablets. It's better nebulized, the N-acetylcysteine. I have not found people to be able to get that from. Also, just putting oxygen, put them in a well-ventilated area. So just having like at least the emergency on hand, minimally, in the office, just in case the patient starts coughing. Because that's probably the worst you're going to see, is seeing some coughing, which you probably, all of us have experienced. Okay. What is your dosages? You know how you find your dosages? You look at your cheat sheet on your units. No, that was a bad joke. Anyway, that's usually I look at the cheat sheet because it's hard for me to keep every detailed number in my head. Honestly, I can't. So I basically look at the dosages that are recommended by the company that makes that ozone unit, but there is an average that you would use for certain expressions. But internal range is usually about 10 to 30 gamma, and then you're using it externally, it's like 40 to 60 gamma. You always want to start with a low dose and go slow. Less is more, is basically what they're saying. So if you have an active infection, 20 to 30 gamma is, like sweet spot. And if you're in a healing mode, then it would be 10 to 20 gamma is what you want to use. So low concentrations show a high efficacy and decreases with increasing concentrations. So that just gives you the principle of hormesis. And basically, poison is in everything and nothing is without poison. It's all about the dosage. So being careful of your dosages, following your cheat sheets, and then when you're dispensing ozone. Okay, this is just another study showing the application in dentistry. For hygiene, the application for us, we're going to be using it mostly for biofilm. As we were talking about yesterday, we were taught in school, calculus was the cause of the patient's periodontal disease. I am here to tell you, it is not the calculus. It's not. Calculus is relatively benign, inert. It does have some non-mineralized areas of biofilm, but it is not the calculus. We is forced in our heads that we had to show proficiency in removal of calcaneous deposits. I don't give a hoot about that damn calculus. I care about the biofilm. I want to modulate the biofilm, modulate the immune system, and that is where I'm going to get my patient healthy. It's not in this presentation, but I have studies that show that even though there's calculus there, if you modulate that biofilm, your patient's going to get healthier, not the calculus. So what are some of the biofilm diseases? Well, of course, it's going to be perio and caries and et cetera. So basically, if they are living independently, if you have a couple of high-risk pathogens, hygienists, if you have a couple of, if you're using microscopy and you have a couple of spirochetes but an abundance of healthy bacteria, you're fine. You don't need to nuke them. Basically, just feed the good bacteria, put that patient on a whole bunch of prebiotics, prebiotic diet, prebiotic toothpaste, not probiotic, but prebiotic, because you want to feed the good bacteria and let your body self-regulate. That is biological dentistry. Otherwise, when they start to proliferate the bad bacteria or the high-risk gram-negative anaerobes, that's when you're going to start to have disease process starting, and that's where the ozone will come in. So when you see a patient like this, they usually want to come in to get their teeth whitened, all right? But in actually, they want their free cleaning. But we know that this patient has a disease process going on, and as I reviewed yesterday for those who were in that class, when I see clinical symptoms of disease, it is not that biofilm that I see necessarily on the lower teeth that's creating it. It's the immune response to the inflammatory initiation from that bacteria. The bacteria is not causing it. Bacteria is causing inflammation. It's triggering the immune system to have symptoms of periodontal disease. It's a mindset shift. That's why you should have came to my class yesterday. No, kidding. So, paradigm shift. So, that being said, how they grow. They will grow not very thick because the clavicular fluid is actually flowing very quickly. So basically, it's just going to continue to shear off. So it only grows about 36 microns, okay? So basically, the bacteria feels like it's under tsunami. So what are some of the problems with the traditional periotherapy? A third of the patients will continue to lose support after surgery and SRP. Why? Because we're only removing calculus and diseased tissue. We're not removing the biofilm or addressing it through use of ozone. When you're using regular SRP, they did a study, 57 patients. They monitored them every 3 months. Basically, gingival redness went from only 68 to 57. This was without ozone, just plain old SRP. Really no difference there whatsoever. So when you have pathogens like this, they're gram-negative anaerobes, this is a place where ozone is going to be the best solution for you. Because when you have an abundance of spirochetes, gram-negative rods, and you're going to have amoeba and spirochetes, also when you have amoeba, best way to kill these guys is the use of ozone. And in my world, I'll also use like a nanosilver. Because ozone parasites do not thrive in oxygen environment, and plus they do not have an antioxidant. So actually, this is a 24-year-old who had a relatively quote-unquote healthy mouth, a couple isolated 4 millimeters in the posterior, pinpoint bleeding. And what happened is I found this amoeba only after I saw an abundance of white blood cells. I did not initially see this amoeba until I saw the white blood cells. And how I know there's your white blood cells. So when I see the immune system being initiated, I'm going to look for a pathogen. All right, and then I'm like, okay, all right, I'm honing in, just like I'm radaring in that thing. I'm going to nuke that guy and hit that with that ozone gas. Those of you who are using ozone water, are you using it through your ultrasonic? Everybody? Great. And if you're not using it through your ultrasonic, I'd like you to. If you have a unit that you cannot hook up to an ozone unit, you're going to get yourself something like a dual select. I had a unit that we had a city line hookup. So we got a contained system with, and I was able to put my ozonated water in there and hook up my ultrasonic to that. And while I was using my ultrasonic, I'm telling my patient, and now I'm going to use my instrument that sprays a lot of water, it's going to vibrate, and we're going to be using medical grade ozone, which is going to help reduce any of the bad bugs. Talk to your patient in a way they would understand. It's going to reduce the bad bugs, and it's going to boost your immune system at the same time. And this study is showing how it really is highly effective when you're using it at the proper dosage. Ozone water, basically low strength. You can see the parts per million, 0.5 to 1. Most bacteria are killed at about 1 part per million. You can make it a little bit stronger, and the next slide is going to show you at what parts per million some of these bacteria are killed. Most of the oral pathogens, like I said, are used like a 1 or 1.5. And usually the kill, it could be 3 seconds or less with ozone. So that's why I like to use that. Now, your half-life. This is an issue when you have an office that's super warm. The half-life of that ozone is going to degrade much quicker. So that's why some offices, I'll tell them to make your big bottle of ozone water, put it in the fridge, and then you're going to be able to replenish, on more frequently, because it's hard to because when you're making ozone water, it takes about 20 minutes. So it's hard. So get a big jug, make a whole big batch of it, put it in the fridge, and then you'll be able to replenish more frequently. Because even though it may still smell ozonated, it's not as effective because it's already degraded. Okay? It can be 8 parts per million, and a half an hour later, we're now at 4, and then a half an hour later, we're now at 2, and then a half an hour later, we're now at 1. Okay, so the cooler your office, the better it's going to last. And you say, well, it's going to be cold. Well, if you put it in your refrigerator, then once it goes through your magneto-restrictive or piezo, it's going to warm up. So it shouldn't be that. It shouldn't be that bad. This is what got me so super excited yesterday. They thought I was nuts. The metabolic. See, it's like there's nothing in the allopathic world that I ever used that did this. I only used that fibroblast inhibitor, that crappy blue rinse, okay, that caused all that staining and that calculus buildup. And people are still using it post-SRP, and they expect the patients to heal. No, it's a fibroblast inhibitor. But ozone has been shown to be highly effective. The ozone water, not even the gas, extremely effective in increasing the activity of the fibroblasts. Why? Because the fibroblast is dependent on the mitochondria. Ozone increases the efficacy of the mitochondria. So any of the cells in the body that have mitochondria, which is all of them, are going to work much better. That's why I want the use of nasal insufflation during your SRP, because local application is good, but systemic is even better. Instead of using systemic antibiotics, you're also going to use systemic ozone. Now, your patients at home can use systemic ozone from the other end. That's the wrong, we have to tip the chair in a different direction to put that. But within the scope of our licensure, we can certainly, do it nasally, and if they have a unit at home, you can have them do it vaginally or anally also. When you're using your ozonated water, I want you to consider keeping some to put in a syringe, because before you touch a periodontal probe or any scaler, you're going to irrigate that pocket, reduce the pathogenic load. Just think about taking, now if you had a phase contrast microscopy, you'll be able to see some of these critters running around. I see a whole bunch of spirochetes. Now, if you're not looking for it, and the tissue is red, inflamed erythrodermatous, bulbous, et cetera, there's got to be some pathogens in there. And I'm taking my periodontal probe and I'm just poking it around in there. The patient's now bleeding. You're not creating the bleeding. It's capillary fragility from the pathogen. You can imagine how many pathogens can actually go shing right into the bloodstream. So patients can do it by brushing and flossing, of course. But if they were brushing and flossing, would it be as inflamed? Probably not. So I don't want to be part and parcel of creating a septicemia on my patient. So before I touch any instrument to go subgingival, I am irrigating with ozonated water. Do it one or two ways. You can use an endosyringe with a side port. It takes about 1.5 minutes to do a full mouth irrigation, and I'm always telling my patient, I'm using medical grade ozone, just squirting it around each tooth, just to make sure we reduce the pathogenic load, because I want to make sure we don't get any bugs into your bloodstream. Keeping it simple. And by the time you're even telling them that, you're already done. Then you're going in with your ultrasonic. Or you can put your ultrasonic on the lowest setting and use it as an irrigant before you touch a probe or a scaler. All right, just making sure that that area is flooded. So it's just showing how effective ozonated water is. The reason why I'm so adamant about irrigating prior to probing, want to take a guess about how many pathogens are stuck to the periodontal probe when you're doing it? Wild guess? About 1 million. And what's happening is even though what's here today is going to be here tomorrow, I'm inoculating every part of the mouth. I did a test once when I was doing the slides, and I actually did one quadrant and put it on one slide, did another quadrant and put it on another slide, so on and so forth. Each quadrant had different pathogens. So even from one on the same tooth, on the distal could be different than what's on the mesial. So what I'm doing is I'm just like spreading the wealth around everywhere. So if I can minimize that, that's why I'm going to use the ozone irrigation prior to. Studies showing how effective it is, antimicrobial for periodontal disease, non-surgical approach. There's another thing I really like, the fact that it causes neoformation of blood vessels. Neoformation of blood vessels, i.e. capillaries and the epithelial tissue, that means there's going to be more blood flow in that area. You're going to have better healing, more oxygenation. It's an amazing, amazing tool. So, most of you are using it in your ultrasonic. If you're not, I'm going to ask you to start to please do that. You can use your ultrasonic during your regular 1110 patients. I know some hygienists, like I was trained to do hand scaling back in the Ice Age. We were not allowed to use an ultrasonic until I had 10 heavies. Could you imagine hand scaling 10 heavies? That's what we had to do. We were not allowed to touch an ultrasonic until we did that. We had to show proficiency in calcaneus deposit removal, which we now know is garbage. So anyway, if you are only hand scaling your 110 patients, your quote-unquote healthy patients, I'm going to ask you to start using the medical grade ozonated water ultrasonic on them, even if it's a quick pass, because you're introducing ozone. Even if you don't have to kill any pathogens, just the fact that it can increase the function of the mitochondria and boost the patient's immune system, you can't hurt them. So I'm going to ask you to not just hand scale your quote-unquote healthy 1110s, but add the use of the ultrasonic also. Medical grade ozonated gas pocket insufflation. I'm going to ask that you please use a cannula, a long cannula, side port. I've been to offices that I've trained, and they showed me what they're using for pocket insufflation. They're using a 10 cc syringe with a blunt end tip that you would use for etchant. How is that getting to the base of the pocket? So I'm going to ask you, if you don't have a handpiece tubing to attach to your unit, I'm sorry, try to put that on your wish list because you're going to be able to serve your patients a lot better. I find using the handpiece when you're doing the pocket insufflation to be far superior than to use just your hand syringe with a blunt tip. So, facts about when you're using ozone gas. Is it toxic? Is ozone toxic? How much ozone can you safely breathe? Your nose will pick it up at about 0.05, which is perfectly safe. And the ozone limits, according to OSHA, you can have 0.1 parts per million maximum concentration exposure for 8 hours, and then 0.3 parts per million no longer than 15 minutes. But if you're using ozone gas, I want to make sure that you are using proper ozone hygiene. You're going to be using a fan and high-speed suction. Okay? Here's a study that shows how effective it is in reduction of pocket depths. That's why I want you to use the long cannula, not that short blunt tip. Okay? Another study showing that it is highly effective. Decreased probing depths, mobility, and good degree of satisfaction indicate clear benefits. Ozone hygiene. What I mean by that, when you are using ozone gas pocket insufflation, you're using either saliva suction or the high-speed suction. They have a unit now, because I know it's very hard to be able to do it yourselves. Hygienists, you're trying to hold your high-speed and Cavitron at the same time. They have something now, it's called a Cordes. You put it on your wrist, and it actually, let's break the watch today. I'm Italian, the hands are going all the time, just saying. So you put that Cordes on your wrist, and it's going to be able to help you hold that high-speed suction. It's going to make it much easier. Because you don't want the gas to accumulate in the patient's here, because then if there's accumulation of gas, that patient is going to start breathing that. It's going to affect their lungs, and then now you are getting it also. So when you are using your ozone, you want to make sure you're using a destructor, which is this little thing right here. What happens, any excess ozone will go into here and break those ozone molecules into O2, which is perfectly safe. Also, if you don't have a fan, go to Target, $5. You don't need a fancy one. Some offices have beautiful, tall, beautiful, little cruddy one, I don't care. Put it on the counter in the back of you. Because if you are working on your patient's here, and you're using the ozone gas, you don't want your fan here, and then you're going to blow the ozone gas right in your face. You want the fan either here or here, because you want it diagonal. It's going to blow the gas away from the patient and away from you. So if you don't have a fan in your op, get a fan in your op, and it's going to help blow away the gas, so that way you're going to be protected from inhalation of any of that ozone. Also, ozone in conjunction with your laser, you're going to get a superior result. If you are in a state like New Jersey that you cannot do laser therapy, I'm going to ask doctors to do the laser for you. Okay? Have the doctors come in, do the laser, which you can charge for it, because you're going to get a much better result, because here you have a study that shows that you get a better result with the laser, with bone regeneration, and also there is a catalytic response when you're using ozone with laser. It's like a chef's kiss. So ozone alone is good, laser alone is good, but the two together is the best. So I'm going to ask you to do that. Another thing you can do is ozone trays. Unfortunately, the company that used to make the custom trays is no longer making them. The company that's here now that has ozone units have custom, like off-the-shelf trays that you could use. They're not custom, but it's better than not. These are great for your perio-maintenance patients. The non-custom trays are relatively inexpensive, so I ask you to go to the table and find out about them. Okay? Really, really cool. If you have patients who have deep pocketing, the 5, 6, 7s, and the posteriors, if you're not giving ozone injections at the time of the SRP, I'm going to ask you to have the doctor to come in to do it. If hygienists are not doing, if they're not anesthesia certified, and they can't give the ozone injection, I'm going to ask the doctor to come on in. When I was doing clinical, My patients got nasal insufflation, ozone water, ozone pocket insufflation with gas, laser, and the doctor also did ozone injections. The results we were getting with our patients were amazing, amazing, because they're getting ozone from every direction, and the ozone lasts for several weeks. So if I see my patient first appointment, they get ozone water, bacterial reduction, they're getting ozone again. I get 4 appointments for perio. I did 1 quart at a time. Ozone, 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 ozone. Those patients resolved amazingly. So do not neglect using ozone injections for your patients. Your gas insufflation. You already have this in the office because you're doing smart removal, right? So there's no added cost there. And then, of course, you can also do your ear insufflation. And here, during that cuckoo shutdown, that's me, glamour shot. It was crazy we had to put all this stuff on. Anyway, every day I gave myself ozonide therapy because I'll be darned if I was going to let that thing get, any virus, because there was multiple studies, I mentioned it yesterday, in Italy where they did studies against, SARS-CoV-2, and they found ozone to be highly effective, which didn't come over here, of course, but highly effective. So I was giving myself ozone therapy every day, and it was all good. So me breathing in that ozonide was helpful for that, but when we inject ozone or use ozone, we are creating ozonides in the body because it breaks down into peroxides, and the results will last for weeks. Your ozone oils, we mentioned quickly, highly effective for local irritations. You can also use it subgingivally in the pockets. Ozone has been shown to be very efficient. This is just another study. I like to throw studies in here. This is not just anecdotal and clinical experience. I want to show you proof that it does work. They did a study and they showed how effective it was. Again, like I said, you can buy these or you can make them yourself. I was training in an office last week and she said, I bought all the little containers to make homemade ozone oil until I read how to do it. And I decided to throw the darn things away and buy them. So I'm not, I have no connection with that company, but it's just too much to do. Incipient caries, highly effective. You use ozone and hydroxyapatite. Studies are showing the effectiveness of that in arresting and actually remineralizing teeth. It's a beautiful thing. Here, another one showing about the ozone application, significantly improved non-cavitated carious lesions. Mostly used in children treating primary carious lesions. You can actually buy an adapter for your ozone unit and be able to cover the tooth. The old unit used to be called the Heel Ozone. And then here, ozone therapy, a new vista in dentistry. It enables the diffusion of calcium and phosphorus ions into the inner surface of decayed tooth. That's how it arrests decay. Dental sealants, for those of you who are using sealants that are BPA-free, bisGMA-free, and fluoride-free, you can use it prior to a sealant placement. There's no deleterious effects to the bond strength. I have a sealant on my tooth from, I can't remember when, we used ozone, maybe about 20 years at least, still there. A little left. Never moved. The bond was incredibly strong because of the ozone. What if a patient has root sensitivity? A lot of our patients come in, my teeth are sensitive, please don't touch this tooth, that tooth, and every other tooth. And it makes life a little bit more difficult, but you can actually reduce sensitivity with the ozone unit you have in your room. Quick relief, 60 seconds, followed by a mineral wash, i.e. you could use your hydroxyapatite. Okay? I used to order hydroxyapatite powder from Europe, have it sent to me. I would mix it with ozone water, and I'd make a slurry. I'd use the ozone gas desensitized, and I would use the hydroxyapatite. Now we have good hydroxyapatite varnishes, and toothpaste have a high value. You could use those, but I would get the powder and then put that on the teeth. Teeth where the sensitivity was gone. Also, waterlines. We have somebody who does the waterline warrior, right? A dear friend of ours. And we talked to her about ozone. She did a study club for us. And she's like, okay, I'm really interested in this ozone stuff. She's like, this stuff, ozone is so much better than any of the other things that you can use for your water lines. Because why? It attacks the biofilm. You'll have no biofilm in any of your water lines. So this is an at-home unit, a fancy one if the patient wants to do the whole 9 yards. And some of our patients do. Some of our patients are very into their health and they want to use ozone for not just dental but other medical reasons. And they can buy packages like this. Now, what if your patient has a water pick at home or oral irrigator, and you're doing periotherapy for your patient and you want to help them modulate the biofilm at home? Because remember, if you're seeing your patient, say, every 3 months for perio maintenance, that's 4 times a year. There's 365 days in a year. That means there's 361 days that is on my patient. I always tell my patient this is a marriage. You know, what I do, it's not one-sided. We got to work together. So whatever I do here, you need to help yourself at home. So if I have a fragile patient that's continually breaking down, or they refuse to get rid of the dog that keeps inoculating them with AA or, you know, pathogens and parasites, or doesn't want to get rid of the significant other who has a mouthful of spirochetes, I can tell you stories. Believe me, I can tell you a story. My own son, in his clubbing days, his slide was so interesting, he refuses to let me do a slide on him ever again. So, you can, truth, yeah. Anyway, he wanted to die. His mama found it. So anyway, you can have them use a water pick, and there's a unit that's coming out in a couple of weeks that you can make ozone at home through electrolysis without having to use oxygen. It's a great unit. It's going to be around $200. So this is going to be coming out in the next few weeks. And they can rinse with it, drink it, use it as a mouthwash, any of that. God bless you. So they can add this to their water pick. So patients who are in periotherapy, active periotherapy or perio maintenance can use the ozonated water home easily. Or we have this unit, which I was gifted and I thought I won the lottery. Oh my God, Bill Landers sent it to me. I'm like, oh. And I brought it to our last conference and Barbara's like, give me that, I want to see that. This is a unit, a water pick or oral irrigator that also makes ozone through electrolysis. So this is what your patients can use at home while you're using your medical grade ozone in the office. All right, so I know I kind of blew through a lot of that stuff trying to cram so much information in there, but there are so many great resources that you can use to get your patients healthy. So you're going to start irrigating prior to your probing or touching a scalar. You're going to start doing nasal insufflation on your SRP patients. If you're not using your ultrasonic on your healthy 110 patients, I want you to start using that on your patients every day and telling them that I'm using this to boost your immune system. You know, we're going to add more oxygen into your system. You're going to be using it to clean your water lines, all right? Because if we have the ability to harness the power of oxygen, we have the power in our hands, and we never had that before. And I get so passionate about it because I know what I can do today, what I couldn't do yesterday. And I'm very appreciative of that. And at that, I'm already getting the hook. So I want to thank you for your time. I appreciate it very much. You can always ask me questions later. Thank you. All right. I'm sorry, I went over.
It's okay.
All right.
Just stand near your mic.